I'm Steve Carawan. I'm an orthopedic surgeon. My family's originally from Eastern North Carolina, but we relocated to Texas when I was 14. My dad was a commercial fisherman and worked summers on my dad's shrimp boat. Went to medical school at University of Texas Medical Branch in Galveston, and then did an orthopedic surgery residency at Texas A&M. I relocated to Eastern Kentucky and have been in Hazard, Kentucky for the past 5 years. I really had an open mind as to what I wanted to do when I went to medical school. My first surgical rotation was on the orthopedic hip service. I remember the first day going into surgery thinking to myself, my goodness, how do you talk these folks into this operation? But when I saw them in clinic 2 weeks later and their pain was already significantly better, and I'd see patients 3 months, 4 months out from hip replacement, just praising the surgeon that did it because they don't hurt anymore. I think that's what I want to do. We've gotten where we can get away from the heavy narcotics that really slow down the patient's rehab and get them moving, sometimes up walking the day of surgery, if not the next morning at the latest. Some patients will go home as early as the day after surgery after a total knee replacement and total hip replacement. Outside of work, I'd say the most gratifying thing is riding my horse. I like to work cows. I have a friend that runs about 150 head of cows and lets me keep a couple of horses there. I used to ride motorcycles some, and I had an awful knee fracture, and I know what it's like to think that I won't be able to do those things. You know, there was a time that I thought I'll never get on my horse again, never be able to do the things I like to do, but I can now, and it's due to the help of a good orthopedic surgeon. I picked up scuba diving over the last year and a half, and I've really enjoyed doing that as well. I've dove wrecks in Eastern North Carolina, done some shark diving there. Prettiest place was diving off of Maui in Hawaii. Some things that we see that we can make almost like new. Some things that we can make a ton better than they were before. But every one of these folks we can treat like it was mama, you know, and that's what I try to do.